Hi, have you noticed how different people are responding differently to the pandemic? I believe you must have. While most of us are taking adequate precautions, some of them have gone into acute anxiety with extreme periods of isolation, hoarding up toilet papers and hand sanitizers. And some of them have gone 180-degree opposite. That is, they are literally partying hard with their friends, going to a bar and not following the social distancing norms, or not even wearing a face mask for that matter. So, what is the psychological reason behind it? It is because our brain perceives different threats differently. So, when we face a newer risk or a threat about which we don't know anything and we feel we aren't able to control it, nor do we trust that the public authorities are able to contain it, we act or react differently. The fear center of our brain, known as amygdala, becomes activated. In other words, our frontal cortex, which is responsible for behavioral actions, tells us something, and our amygdala, our emotional center, tells us something else. So there is a lot of crosstalk between, and our brain gets short circuited ultimately. The amygdala takes over, and we act based on fear now. This is, in a way, good, as we are able to take precautions and stay safe. But when we expose our brains and ourselves to prolonged periods of stress and fear, what happens is that the part of the brain responsible for logic start physically shrinking, and then we aren't able to take any logical action. So what we do is we go and take extremely irrational calls, such as thinking that we have had a lot of isolation, we have taken adequate precautions, now nothing is going to happen to us. We are going to go out and enjoy. So, now that you know this little organ of yours called the brain functions and controls you totally, you will be able to take more prudent calls and avoid any impulsive decision. Stay home, stay fit, stay safe. Bye bye.